Hi, good morning, everybody. The most dreaded complication of the intumescent white cataract is the Argentinian flag sign. A lot of people have said a lot of ways. I also started a lot of ways. We started with the spiralrexis and then putting this 26 gauge needle and sucking out, milking out the capsular matter and the cortical matters. And there was recently Dr. Arvind Maurya has come out with the sieving needle method. He give the punch and then he starts doing the rexis. But what I feel is the so popularized by Dr. Mohan Raj and the Panchorexis, which I started in 2014, was a Ashoka Chakra sign to replace Argentinian flag sign. Just want to give you the glimpse of that. So when I started, I also did spiral capsulorhexis using high viscous fluid, debulking it in between. This is an old video. We started with a small rhexis, then extending it to the bigger one, to the desired one. This is the second one. This is not a white intumescent cataract. It is just for the demonstration that you start with a very small rhexis, very small, and then extend it to the desired size of rhexis. But this nanophaco for Ashoka Chakra, like Panchorhexis, it works fantastic. You punch, stay there for some time, remove it after putting the viscoelastic, and continue with the rhexis. You have to have the trypan blue. Another case, give a punch. You don't have to come out immediately. In the last two clippings, I'll be sharing more details. So this is the rule rather than exception. It's not a fluke. It goes on very well. It has the learning curve, of course, but certain tips I'll give you. So for doing this, you have to make a very small side port so that you could, the since hook can enter. It doesn't leak fluids from there. Another case. Good Ashoka Chakra sign, and then go ahead with the rhexis, very controlled one. All you have to see that sometimes the zonules are weak, so you have to be very, very careful. Sometimes the capsules are thick, you have to be very, very careful. Another case. Now, if you do not do it properly, then Argentine flag sign will happen. See, I am in quite periphery, and then this happens. So if you're trying all these things, you have to be, expert in converting all kinds of rhexis into a proper rhexis, and which is not tough. I always remove my speculum and see the condition of the anterior chamber. Another case. when the Argentinian flag sign happened, again look at, I'm in quite in periphery. If you start here, it will happen. Now, please look at these, the newer ones. I go in the center, look at the parameters. I foot pedal 1, 2, 1, 2, and then give a punch at the punch, hold it there. Keep on sucking the fluid, keep on sucking the fluid. Absolutely no problem. And then remove it, put the viscoelastic, and then complete it. Next case. Go inside, irrigation on, off, and then quad mode, give a punch, hold on, keep on sucking the fluid, keep on sucking the fluid, keep on sucking the fluid, inject the viscoelastic, and then complete your rhexis. So this makes your life very, very easy. That's all I had to say.